typing on our computers, cooking meals, playing sports. We use our hands a lot, especially if you're Greek and you talk like this. But when pain strikes, it can really keep us from taking care of those everyday tasks. Dr. Jennifer Manuel is an orthopedic surgeon at the Jacksonville Orthopedic Institute. Thank you so much for being here today.
Thanks for having me.
So you are an orthopedic surgeon specializing in hand and wrist surgery, but what I think is so interesting are that a lot of the common problems that you see really just affect women.
There are certain problems that do tend to affect women more than men. Women tend to get more overuse type injuries where we see more carpal tunnel syndrome, which is numbness in the fingers. We see more tendinitis. And the thing I see most commonly more in women than men is arthritis at the base of the thumb.
Well, let's talk a little bit more about that. What is osteoarthritis at the base of the thumb?
Osteoarthritis is a condition where the cartilage that lines the bones of the joint wears out with time. And so over time, as you lose that cartilage, the joint changes and starts to become more painful. And so it becomes hard to do things and use your hands normally.
And so I asked you this question earlier, but I think it's really asking again for our viewers. This is not something that physical therapy would really help. In fact, it actually hurts your thumb.
Sometimes, yeah, therapy for a lot of things can be very beneficial, but for arthritis at the thumb base, it often is not, because it is a problem where the more the joint is used, the more it hurts. Therapy tends to not be as helpful for this type of problem.
So let's talk about some of the symptoms. What would be some of the symptoms that somebody who is suffering from thumb CMC joint arthritis have?
Well, it tends to be a problem that, again, affects more women, usually mostly women over the age of 50, although sometimes we'll see women at an earlier age come in with symptoms. The most common complaint that I hear patients tell me is gradual increasing pain at the thumb base, which is kind of within the wrist, between the thumb and the wrist. And it just becomes hard to do things. They have pain when they're opening doors or unscrewing lids on jars, lifting heavy trays or dishes can become very painful.
And I'm just going to throw this out there. I think that women probably suffer from this more because we do more. But is there any research to show why women are suffering from this more than men?
I think there is some genetic predisposition in that females have more hormonal influences on their joints. And this is a very small, highly mobile joint with small, tiny little ligaments. And so hormones that women have through their childbearing years tend to make those ligaments a little bit looser, and over time the joint tends to wear out a little bit more in the female population.
And I was also sharing with you, both my grandmothers suffer from severe, arthritis in the hands, and it's almost like there's a deformity in the hand as they age. Before it got to that point, I know it was kind of hard for a diagnosis. They just kind of felt like, it was just pain. How do you diagnose, arthritis in the hand?
The way we diagnose it is with a thorough history where we gather the symptoms that the patient's describing, and often it fits that pattern we've talked about. There is a specific test called a CMC grind test, where when you take the thumb, if you kind of move it around and compress the joint at the base, that tends to elicit pain. And then x-rays are really the hallmark for diagnosing arthritis there.
And we've already kind of ruled out physical therapy as, a typical treatment. What are the treatments that are involved for somebody who's suffering from this type of arthritis?
Well, we tend to tailor treatment based on patient's symptoms. So even though a patient may have a more mild form of arthritis on x-ray, if they have severe pain, then we treat that. If they have severe findings on x-ray but less pain, we tend to not need to be as aggressive with treatment. But there are really 4 options to treat the arthritis of the thumb. The first option, and the simplest, least invasive option, is to have a splint fabricated, which immobilizes the thumb. And the splint that we use is small, but it still provides some support to that joint so that it doesn't move as much with activity. And again, if it doesn't move as much, patients will find that they're able to do more without as much pain. We also have arthritic specific anti-inflammatories, which come in both oral and what I prefer, topical form, where you can apply a gel to the skin that gets absorbed through the skin and gives some anti-inflammatory relief to the joint. If that fails, the next more invasive treatment option would be a cortisone injection or a steroid injection into that particular joint, which tends to, on average, provide about 3 to 6 months of pain relief. And if all fails and a patient still cannot function or do the things that they would like to do with their hands because of pain, then we start talking about surgical treatment options, which tend to provide amazing relief, but take about 3 months to recover, right. And you know, is a little painful when we're
such valuable information, because I know how painful it can be. So we want to get our viewers that information. Thank you so much for being here.
Thank you.
And we'd like to thank the Jacksonville Orthopedic Institute for sponsoring this segment. Again, for more information, visit joi.net or call their office at 904-JOI-2000.